When Dr. Everett Rhoades became the first member of the Kiowa tribe to earn a medical degree, he did more than make tribal history. He set the stage for a lifetime of accomplishments for American Indians. From his tenure as head of the Indian Health Service to his establishing the Association of American Indian Physicians, he has been a tireless teacher, researcher, scholar, and healer. Born into the Oklahoma Dust Bowl in 1931, Everett Rhoades showed early intellectual curiosity. He earned a scholarship to Lafayette College in Pennsylvania and graduated from the Oklahoma School of Medicine. It was during his Canal Zone internship that he developed his interest in infectious diseases. He returned to Oklahoma for residency and began his career as an Air Force medical officer at Lackland Air Force Base, Texas, where he established an infectious disease section. He returned to University of Oklahoma, gaining national recognition. In 1971, he gathered together 14 Native American physicians and established the Association of American Indian Physicians. The organization, now with a membership of nearly 400, has mentored many in the spirit of Indian culture. In 1972, he helped establish the Oklahoma City Indian Clinic. It quickly became one of the area's largest urban Indian health centers. In 1982, he left the university to take on what would become his most prominent role, Director of the Indian Health Service. He was the first Indian to hold the position, responsible for the health of the entire country's American Indian and Alaska Native population. Under his guidance, IHS went from being a bureau to an agency. Its resources more than doubled. Dr. Rhoades also increased community involvement in health policy via a tribal leader consultation process. Following his years at the IHS, Dr. Rhoades served as Director of Education Initiatives and Adjunct Professor at Johns Hopkins School of Hygiene and Public Health. Among his accomplishments, he established the first ever internet course on Indian health. Back at the University of Oklahoma College of Medicine, he was Associate Dean for Community Affairs, Adjunct Professor of Medicine, and Director of the Native American Prevention Research Center. In those roles, he strengthened the university's commitment to Indian health issues. Now 80, Dr. Rhoades remains busy. In addition to serving as a professor emeritus at the University of Oklahoma, chairing boards and authoring papers, he continues to participate in activities with the Kiowa Blacklegging Society and the Kiowa Gourd Clan. And of course, he spends time with his family, which includes his wife of 58 years, Bernadine. He and his wife travel frequently to see their 12 grandchildren and instill in them an appreciation for their Native American heritage. It's a gift he's always been proud to share.